Good evening, everybody. In today's lecture, we'll learn about a very important drug, which is amphotericin B. Amphotericin B has been used for many years as an antifungal agent. It is an antifungal agent which has been used for many years, but its use has been limited for the systemic infections only. That is, if the patient is suffering from the systemic infections and if there is a rapid requirement of the therapeutic response, then only in those cases the amphotericin B is prescribed. Why is it so? Because amphotericin B is associated with a wide range of toxic effects, mainly nephrotoxicity. And also, there are many other toxic effects which are associated with the use of the amphotericin B. So, we use only amphotericin B, which is an antifungal agent. We use only mainly for the systemic infections. It is given mainly through the IV routes, intravenous routes. So, how this amphotericin B was derived? So, there are two forms of amphotericin B: amphotericin A and amphotericin B. Now, this amphotericin A and amphotericin B, both are having antifungal effect. Both are having antifungal effect, and these both are derived from the microorganism which is known as streptomyces nodosus. Streptomyces nodosus. Okay. There are two forms, amphotericin A, amphotericin B. Both are having antifungal properties, and they are obtained from a microorganism, that is streptomyces nodosus. The amphotericin A is not in the clinical use. We use only amphotericin B. Okay, so moving towards the pharmacokinetics and the chemistry of the amphotericin B. So amphotericin B is an amphoteric polyene macrolide. This amphotericin B is an amphoteric polyene macrolide. Now, what do I mean by the amphoteric? Amphoteric means, like for example, there are some drug which acts as a weak basic, say phenytoin, and there are some drug which are weakly acidic. But amphotericin acts as a both acid as well as base. So that's why it is called amphoteric. Okay. Polyene means many. Poly means many. Ene means double bonds. Right. So amphotericin is having lot of double bonds, and it is a macrolide. Macrolide means is containing a large lactone ring. Okay, large lactone ring of 20 carbon atoms or more. Amphotericin B, from its name, suggests that it is amphoteric, means it acts as a both acid as well as base. It is polyene, that is, it is containing a lot of double bonds, and it is a macrolide, meaning that it is having a large lactone ring of 12 carbons or more. Moving towards the structure, now as you can see, in the one segment of this structure, there are a lot of double bonds. And in the one segment of the amphotericin B, there are a lot of hydroxyl group present over here. Okay, there are a lot of hydroxyl group present. 1, 2, 3, 4, 5, and 6. So this segment, in which is rich in the double bonds, makes it lipophilic. Makes it lipophilic, makes it lipid loving. Okay, so we can say that the segment of the amphotericin B structure, which is having a lot of double bonds, makes it lipophilic, lipoloving, and the segment of the amphotericin B, which is having a lot of hydroxyl groups in it, that is OH groups in it, makes it hydrophilic. Hydrophilic. This is the lipophilic segment. Lipid loving, this is the hydrophilic segment because of the hydroxyl group present, making it water loving. Now, this both segment has effect in the mechanism of its action. Now, how? With that, we'll see in the mechanism of action that how this hydrophilic segment and the lipophilic segment affects in its mechanism, has a role in its mechanism. That we'll see in the mechanism of action further. So this amphotericin B, moving towards the properties, this amphotericin B is water insoluble. Okay, it is water insoluble. As it is water insoluble, so we can prepare the target delivery system. That is, either we can prepare the colloidal suspension, we can either prepare the colloidal suspension of the amphotericin B, or we can make a conventional preparation with sodium deoxycholate. With the sodium deoxycholate, when it is given with this, when it is made with sodium deoxycholate, it is given mainly through the intravenous IV infusions. Whenever it has to be given in the IV infusion, it is prepared with the sodium deoxycholate, and this is known as the conventional preparation. Conventional preparation. Okay. It is given mainly through the IV routes in the systemic infections. Now, also there are some oral formulations of the amphotericin B which are not very much widely used. Mainly, it is used intravenously because of the toxic effects. First reason why it is given intravenously and not orally, because first of all, it is very poorly absorbed from the GI tract, very poorly absorbed from the GI tract. First reason. Second reason, it is having a lot of toxic effects. It is nephrotoxic, right? This could be the second reason. But still, there are the oral formulations of the amphotericin B which are rarely used, particularly for the fungi infections which are present in the lumen of the GI tract. Say in the case of the intestinal molyliasis. Okay, we can use this in intestinal molyliasis. So there it acts locally, or if it is given orally, it acts locally in the lumen because it is poorly absorbed in GIT. It is having a lot of adverse effect. And if it is given in the IV with the sodium deoxycholate, it is mainly given at a dose of 0.6 mg per kg per day, reaching the blood levels of 0.3 mg per ml. Okay, if it is given IV, it should be given at the dose of 0.6 mg per kg per day, reaching the blood levels of 0.3 mg per ml. Okay, now moving towards the pharmacokinetics. So, amphotericin B is 90% plasma protein bound. Okay, it is 90% plasma protein bound, and it is metabolized in the body, and it is excreted in the urine and in the bile. It is excreted in the urine for several days. That means for it remains in the body for a prolonged period of time, and it excretes slowly into the urine. Okay, the excretes slowly over the period of time in the urine and in the bile. Okay. Now, the patients who are having hepatic impairment, or the patients who are having renal impairment, or the patient who are on the dialysis, okay, so in that conditions, the drug concentrations is slightly altered. Okay, hepatic impairment, renal impairment, and the patient who are on the dialysis, there may be slight alteration in the drug concentration. Correct? Okay. And approximately 2 to 3% of the amphotericin B is found in the cerebrospinal fluid, so which occasionally necessitates its use as the intrathecal injection for certain fungal meningitis. Okay, which netted, so as 2 to 3% of the amphotericin B reaches in cerebrospinal fluid, so it necessitates its intrathecal injection for certain type of fungal meningitis. Okay. If it is caused by fungal, then we can give amphotericin B intrathecal injection as well. Talking about the half-life, so the half-life is approximately 15 days. Okay, The half-life of the amphotericin B is approximately 15 days. Now we'll go to the mechanism of action of the amphotericin B. How this amphotericin B works. So amphotericin B is a specific. It is having a specific fungicidal effect. It kills the fungus. Okay, it kills the fungi cell. It is having a specific fungicidal effect. Now, first of all, we'll see the basic difference between the fungi cell and the mammalian cell. Like, for example, this is the fungi cell. I'll draw it here. This is the fungi cell. Okay. And this is the mammalian cell, say, or the human cell. Okay. There are intracellular bodies present inside the fungal cells and the mammalian cell. Okay. This is the fungal cell. This is the mammalian cell or the human cell, right? Now there are a very small structural differences in the plasma membrane of the fungal cell and the mammalian cell. There is a very small structural differences in the plasma membrane or the cell membrane between in the fungal cell and in the mammalian cell. So we'll see this fungal cell membrane. Okay, so we'll draw here the fungal cell membrane. Okay, these are the phospholipid bilayers. Okay, these are the phospholipid bilayers. In addition to it, it contains several chitins. Okay, this is the fungi cell wall or the plasma membrane. Okay, what are these structures? We will discuss. Okay. Okay. Now these are the manoproteins. These are the manoproteins. These are the complex polysaccharides which provides rigidity to the plasma membrane or the cell membrane of the fungi, which is known as beta 1,3 glucans or beta 1,6 glucans. Okay, these are known as chitins. These are known as chitins. This is the plasma membrane, which is composed of the phospholipid bilayer. Okay, which is composed of the phospholipid bilayer. Now, this entire structure provides the mechanical strength, and the rigidity to the fungal cell wall. And also this all these manoproteins, this beta 1,3 glucans and the chitins protects the fungal cell wall from the exogenous or the hostile material which is present outside in the in the exogenous environment. Okay, from the hostile environment. It also provides mechanical strength and provides rigidity. Now, in this plasma membrane, the major sterol present in the fungi plasma membrane is ergosterol. This is ergosterol, which is the major, this is very important, which is the major sterol, present in the plasma membrane of the fungal cell. And whereas the major sterol present in the mammalian or the human cell wall is cholesterol. Okay, is the cholesterol. So this is the major difference between the fungal cell wall and the mammalian cell wall, that in the fungal cell wall the major sterol present in the plasma membrane of the fungi is the ergosterol. This ergosterol maintains the integrity of the fungal cell membrane, and whereas in mammalian cell the major sterol present in the cell membrane is cholesterol. So this is a very important difference. In mammalian cell, the major sterol is cholesterol, and in the fungal cell, the major sterol is the ergosterol. Okay. Now, what this amphotericin does, this amphotericin, okay, this amphotericin will bind to this ergosterol. Okay. This amphotericin will bind to this ergosterol, which is a sterol present in the fungal cell wall. As discussed, that there are two components of the amphotericin B. Okay, there are two components of the amphotericin B. For example, this is the lipophilic segment. This is the hydrophilic segment. This lipophilic segment mainly which is having double bonds. This lipophilic segment which is having double bonds in the amphotericin B, this is amphotericin B. It is having two portion, that is lipophilic segment, hydrophilic segment. The lipophilic segment, which is rich in double bond, will bind to the lipid materials. Okay, will bind to the lipid materials. This hydrophilic segment, which is containing a lot of hydroxyl group, will bind to the water molecules. Will bind to the water molecules, and what will happen? It will bind to the ergosterol, and it will create a pore in the cell membrane of the it will create a pore in the cell membrane of the fungus. Okay, so what will happen when it will create a pore by binding to this ergosterol? It will impair the membrane fluidity. Okay, it will impair the membrane fluidity, or the membrane won't be able to maintain its integrity, and the membrane won't be able to maintain its microenvironment, right? It won't be able to maintain its microenvironment as it creates the pores. So it will lead to the leakage of the intracellular components that ultimately lead to the fungal cell death. Okay, that leads to the fungal cell death. So amphotericin B is a specific, it has a specific fungicidal effect. Now, apart from the binding with the ergosterol, which is the sterol present in the plasma membrane of the fungi, this amphotericin B also has the affinity for the cholesterol. As ergosterol in the fungi cell walls maintains the integrity, the cholesterol, which is a sterol present in the plasma membrane of the human cell, also has the same function. That is, it maintains the integrity of the cell membrane. It protects the it protects the human cell. So what happens? This amphotericin B is having a lower affinity for the cholesterol, which is present in the human cell wall. So also it damages the human cell. Particularly, it has the affinity for the renal epithelial cells, and renal vasculature. So what will happen? It will create pole. It will have the same mechanism. It will amphotericin B will bind to this cholesterol, and it will damage the integrity. The cell won't be able to maintain its microenvironment. It leads to a leakage. It particularly has the affinity for the renal epithelial cells, which are present in kidney and renal vasculature. So amphotericin B is said to be nephrotoxic. Nephrotoxic. It is very, very important. Okay. For this reason, amphotericin B is nephrotoxic. because it is having the affinity for the cholesterol as well, which is present in the human cell wall. Apart from the ergosterol, which is present in the fungal cell wall, it will damage the cell, particularly the renal epithelium, and it will have nephrotoxicity. Now, this was the mechanism of action for the amphotericin B. There are also many other antifungal agent called the nystatin. Okay, we have another antifungal agent known as nystatin. It is also having the same mechanism of action. It is also having the same mechanism of action, that is, it binds with the ergosterol of the fungal cell wall. But this nystatin is very very toxic. It is very very toxic, even compared to the amphotericin B. It is not absorbed from the topical route, so the amphotericin B is not used. Apart from the amphotericin B, we have other classes of antifungal. So we'll have a quick review about their mechanism of action as well. So first of all, we'll understand that how the this fungus biosynthesize its ergosterol. Okay, how this ergosterol is synthesized in its cell wall. This ergosterol is synthesized from a very important material which is known as squalene. Okay, this ergosterol is biosynthesized, or the starting material required for the biosynthesis of ergosterol is squalene. This squalene, in the presence of the squalene epoxide, in the presence of the squalene epoxidase, in the presence of the squalene epoxidase, gets converted to lanosterol. Gets converted to lanosterol. This lanosterol, in the presence of cytochrome P450 enzyme, which is the 14 alpha demethylase, gets converted to ergosterol. Okay, gets converted to ergosterol. Squalene, being the starting material, in the presence of the squalene epoxidase, gets converted to lanosterol. This lanosterol, in the presence of the CYP450 enzyme, which is 14 alpha demethylase, gets converted to ergosterol. Now, what happens that there is a group of antifungals which is known as allyl amines. Okay, known as allyl amines. What this allyl amine does, that it inhibits this squalene epoxidase enzyme. Okay, it inhibits this squalene epoxidase enzyme. What happens, the squalene won't be able to convert it into lanosterol. Ultimately, lanosterol won't be able to synthesize, and the from the lanosterol, ergosterol won't be able to be biosynthesized. So it blocks the production of the ergosterol, which is the major steroid present in the plasma membrane. So ultimately, it will lead to the fungal cell death. Now, what are the examples of these allyl amines? These allyl amines are naftifin. First, naftifin. We have terbinafine. Okay, we have terbinafine. We have butenafine. Okay, we have butenafine. Butenafine. So these are the group of allyl amines which inhibits this squalene epoxidase enzyme, and ultimately it will lead to the fungal cell death. Then we have a group of antifungals which are called azoles, What these azoles will do, it will inhibit this cytochrome P450 14 alpha demethylase. It will inhibit. So what will happen, that the lanosterol won't be able to get to convert into the ergosterol. It blocks the production of ergosterol, which is present in the cell membrane. Ultimately, it will block the cell wall synthesis and will lead to the fungal cell death. It is a fungicide. Now, what are the example of this azole? Say clotrimazole. We have fluconazole. Okay. We have itraconazole. We have ketoconazole. we have miconazole. Okay, so these are the examples of azoles which inhibit the cytochrome P450 enzyme, which is 14 alpha D methylase, ultimately leading inhibiting the cell wall synthesis and leading to the fungal cell death. Now, this squalene epoxidase and the CYP450 enzyme 14 alpha demethylase are also present in the human cell wall, are also present in the human cell wall. So what happens, this allyl amines and azoles are also having lower affinity for the squalene epoxidase and the CYP450 enzyme, which are present in humans. So ultimately this will lead to the toxicity. This will lead to the toxicity. Then we have another antifungal class which is known as echinocandins. Now, there are two very major advantages of echinocandins over allylamines and azole that we'll discuss. First, we are having echinocandins. What this echinocandin does, it blocks an enzyme. It blocks an enzyme. Which enzyme? This enzyme is present in the cell wall of the fungus. Particularly, this enzyme is found in the cell wall of the fungus. What is the function of this enzyme? This enzyme is responsible for the production of the complex polysaccharide beta 1 3 glucans, which, as discussed, is important for maintaining the rigidity and provide the mechanical strength to the fungus cell wall. Okay, this enzyme is responsible for the synthesis of the complex polysaccharide, particularly the beta 1 3 glucans, which maintains the cell rigidity and provides the mechanical strength. Now, what is the name of this enzyme? This enzyme is called beta 1 3 glucan synthase, which is present particularly in the cell wall of the fungus, responsible for the synthesis of beta 1 3 glucans, which has the function of maintaining the rigidity and the mechanical strength. Now, this echinocandins blocks this enzyme, that is beta 1 3 glucan synthase, which ultimately blocks the production of the beta 1 3 glucans. So as a result, the fungal cell wall will have the impaired membrane fluidity, will have the impaired membrane fluidity, lead to the accumulation of the toxic sterols, of toxic sterols, and this ultimately leads to fungal cell death. This ultimately leads to the fungal cell death. This echinocandins will block this beta 1 3 glucan synthase, which will block the synthesis of a beta 1 3 glucans, which is responsible for maintaining the mechanical strength and the rigidity. So this, what will happen? It will have the impaired membrane fluidity, accumulation of the toxic sterol, and ultimately will lead to the fungal cell death. Now, what are the benefits of this echinocandins over allyl amines and azoles? So first of all, the very important advantage that this echinocandin carries is it blocks the enzyme beta 1 3 glucan synthase, which is not found in the human cell, So what will happen? Ultimately, it will reduce the toxicity. It is having the reduced toxicity as compared to the my allyl amines and the azole. Second most important advantage is that of the echinocandins, that it can be used in the azole resistant candida infection. Okay, those candida species, candida are the fungus which is responsible for causing certain infections in the humans: mouth infections, skin infections, vaginal infections. So those candida species which are resistant to the azoles, so echinocandins becomes a choice of drugs in those species. So these are the two main advantage of echinocandins. over azoles and allylamines, that it blocks the enzyme glucan synthase, which is not found in the human cells. Ultimately, it reduces the toxicity. Also, it can be used in the azole resistant candida species, those candida species which are resistant to the azole. Okay, so it has an advantage over the azole and the allylamines. Now, coming towards the clinical uses of the amphotericin B. Amphotericin B binds to the ergosterol. We will summarize its action. Binds to the ergosterol, which is a major sterol present in the fungal cell wall. It will ultimately inhibit the cell wall synthesis and will lead to the fungal cell death. Now, these are the examples of the fungal species which is responsible for causing certain infections or certain conditions in the human cell. So, whatsoever pathological condition these species causes, amphotericin B is used against them. Okay, so first of all, we have the Candida albicans. Now, what Candida albicans causes is the Candida albicans causes certain mouth infections, skin infections. It causes certain throat infections. It causes certain gut infections. It causes certain vaginal infections. Okay, vaginal infections. So the amphotericin B becomes a choice of drug against the Candida albicans. Then we have the Cryptococcus neoformans, which is responsible for causing fungal meningitis. Meningitis. Okay, it is responsible for causing fungal meningitis. So if the meningitis is caused by the Cryptococcal neoformans, amphotericin B is a choice of drug. Then it is effective against Histoplasma capsulatum, which is responsible for causing certain pulmonary infections. Pulmonary infections. Okay. Then we have the blastomyces dermatitis. Yeah, as we can see in this image, it can cause the cutaneous lesions. Okay, this blastomyces dermatitis causes certain cutaneous lesions. So amphotericin B becomes a choice of drug for such a cutaneous skin infections. Then we have the Coccidioides immitis, also causes pulmonary infections. Pulmonary infections. Okay. Then we have the Aspergillus fumigatus, that is responsible for causing such as certain pulmonary Aspergillus infections. Okay, pulmonary infections. Then we have the candidiasis of the esophagus, candidiasis of esophagus to the HIV infections, and the candidiasis of the urogenital site. This is very common in females as compared to males. Okay, so we have certain topical preparations of the amphotericin B. So in the urogenital site or in the vaginal site, if it causes any infection is caused by the candidiasis, the amphotericin B topical preparations are available, which are useful. Then it is used in the mycotic corneal ulcers and keratitis. This is the example. It causes the keratitis, which is the sort of eye infection. So there are the topical drops of the amphotericin B available, as well as apart from the topical drops, we have the subconjunctival injections. Okay, we have the subconjunctival injections, which is given directly to the conjunctiva in such a conditions. So we have certain topical preparations, like we have creams, which is used for the urogenital size vaginitis, and we also have certain topical drops, as well as we have the subconjunctival injections of the amphotericin B, which is used in such a conditions, that is in keratitis and corneal ulcers. Okay, then coming towards the adverse effects. So this is very very important, because this is the major reason why the amphotericin B is not widely used, and it is only given through the even if it is given through the intravenous infusion, it is given only in those conditions where there is a rapid therapeutic response needed. Okay, in the serious conditions. So we have two types of adverse effect. We have the infusion related toxicity and we have the cumulative toxicity. What is the infusion related toxicity? That if we infuse the amphotericin B at the higher rates than the normal, then the patient presents with a fever, The patient presents with the chills, the patient presents with the muscle spasms, okay, the patient has vomiting, okay, the patient has vomiting, the patient has hypotension, okay, the patient experiences headache. Even the infusion rates are even slightly higher than the normal. Then the patient present with such an adverse effect, that is fever, chills, muscle spasm, vomiting, hypotension, headache. So even if it is given through the intravenous route, it should be given very very carefully, it should be infused very slowly, otherwise it will cause the infusion related toxicity. So as a pre medication, we can also prescribe antipyretic, we can also prescribe antipyretic, we can prescribe with antihistamines, we can prescribe uh, certain corticosteroids, okay, to get relief, or even by infusing it at the slow rates, we can get relief with this toxic effects. And we have the cumulative toxicity. Now this is very much important. One of the major cumulative toxicity is it is nephrotoxic. That means it is causing renal toxicity, okay, it is causing renal toxicity. This is very very important. Why? Because it is having affinity for the renal epithelium, okay. So in the renal epithelial cells, we have the cholesterol present in the plasma membrane. Amphotericin binds to the cholesterol, leads to the generation of pores that ultimately alters the microenvironment of the cell and leads to the cell death. Now it also causes a very common clinical condition which is known as azotemia. What is azotemia? Azotemia is the increased urea level, okay, is the increased urea level, which is again one of the important adverse effect of the amphotericin B. In the renal toxicity, mainly the amphotericin B causes the renal acidosis, and it causes the potassium and the magnesium wastage, okay, it causes this potassium and the magnesium wastage. Apart from this, apart from the renal toxicity, it is also causes the, it is also a liver toxic, it causes hepatotoxic, it is a hepatotoxic. Then in addition to this, when it is given through the intrathecal rule in a case of the fungal meningitis, it is when it is given to the intrathecal routes through the fungal meningitis, it increases the risk of the seizures, okay, it increases the risk of the seizures. And also, as it is a renal toxic, normally in the renal, in the kidneys, we have a glycoprotein hormone known as erythropoietin. What this erythropoietin does, you know, this erythropoietin is responsible for the production of the RBC in the normal condition. This erythropoietin is responsible for the production of the RBC. So while taking amphotericin B, which is highly renal toxic, it alters this erythropoietin. Ultimately, it blocks the production, or it reduces the production of the RBC, and it leads to anemia. It leads to the anemia. So these are the major adverse effects of the amphotericin B. It is renal toxic, causes azotemia, renal acidosis, potassium and magnesium wastage. Also, it is hepatotoxic. Through the intrathecal rule given in the cases of fungal meningitis, it can increase the risk of the seizures. And as it is renal toxic, it blocks the erythropoiesis, which is the RBC production, and it leads to the anemia. Whenever we buy amphotericin B IV solution, we have a certain black box warning. What is this black box warning? That the dose of the amphotericin B should not be greater than 1.5 mg per kg. Okay, the dose of the amphotericin B should not be greater than 1.5 mg per kg, otherwise it may lead to the toxic effect. Also, exercise. Whenever amphotericin B is prescribed to the patient, they should not exercise. Why? Because it is carrying a risk, cardiopulmonary arrest risk, it is cardiotoxic, okay. So whenever the patient who is prescribed with the amphotericin B, or there are also other drugs which are cardiotoxic, okay. So amphotericin B is one of them. So exercise should not be done by that patient, okay. This is a very very important black box warning which is present on the um, packing of the amphotericin B whenever we buy, and its dose should not exceed 1.5 mg per kg. Okay. Then coming towards the formulation, as discussed, we have amphotericin B is poorly water soluble, so we have certain targeted drug delivery. Correct. It is that is, it is mainly given as a decolloidal suspension. We have the colloidal suspension. We have the lipid complex. We have the liposomal amphotericin B. Okay. Then for the intravenous preparation, as discussed, it is paired with the sodium deoxycholate. Yes, it is paired with sodium deoxycholate for the intravenous preparation. So this preparation is known as conventional amphotericin B. Why such a preparation is made? Because these are the targeted drug delivery. Okay, these are the targeted drug delivery. What is the motive of the targeted drug delivery? To reduce its toxicity. Okay, it reduces its toxicity. That is, it reduces the acute reactions. The patient who are having allergic reaction, the patient who are having anemic, yes, it carries the risk of causing anemia, right? So it reduces its side effects. Also, it reduces nephrotoxicity to some extent by preparing into the conventional preparation. So one of the disadvantage of such a preparation is that these targeted drug delivery or the targeted preparations are very, very expensive, which is also one of the factor which limits the use of amphotericin B as a choice of drugs. Coming towards the dose, so as discussed, mainly it is available for the intravenous use only for the systemic infections, and that too only when there is a immediate therapeutic response needed. But there are few oral dose over for oral formulation available, which are used for the fungal infection caused mainly in the intestines, say intestinal molalliasis. So in such a cases, very rarely we prescribe the oral formulation. So the dose is 50 to 100 mg. We prescribe amphotericin B, which acts locally in the intestine. Okay, otherwise it is used only for the systemic infections. Also, it we use topically. For the topical, we have certain tubes which is used for the vaginitis, and also there are ear drops available for the ear infections. We have the automycosis. Okay, automycosis is a ear infection, so we have the fungi zone otic 3% ear drops. Okay, so we have topical preparation in which the amphotericin B can also be used in the ear drops. Then for the systemic mycosis, that is for the systemic infections, we have the conventional amphotericin B. Conventional amphotericin B means when the amphotericin B is prepared with sodium deoxycholate, it is a dry powder available. This dry powder, how this dry powder how the formulation is prepared, it is available in the dry powder with the sodium deoxycholate. Okay, so if you want to use this in the IV, first of all, this dry powder is mixed with a 10 ml of water. Okay, there is sterile water for injection available. We have 10, we have to first disperse or suspend it in a 10 ml of water, and then further we have to dilate in 100 ml of a glucose solution. Why only glucose solution we have to use? We cannot use normal saline in this because it makes the suspension coarse. Okay, it makes the suspension coarse, so we should use only glucose solution. First of all, the powder is mixed in 10 ml of water for injection, then further it is diluted in the 500 ml of glucose solution. Before starting this amphotericin B, before it is given intravenously, the patient is tested for the hypersensitivity. So initially 1 mg of the dose is injected IV. Then we have to wait for 20 minutes. If there is no reaction, then we have to start the infusion with the 0.3 mg per kg for 4 to 8 hours. Now, if this 0.3 mg per kg is well tolerated, then slowly we have to increase the dose to 0.7 mg per kg. If it is tolerated to the patient, okay, then we can increase the dose to 0.7 mg per kg, and the total dose of the amphotericin B that should be given is between 3 to 4 gram over 2 to 3 months, not more than this. Otherwise it may increase the risk of the nephrotoxicity. Okay, and the intrathecal injections used in fungal meningitis should be given 0.5 mg twice weekly for the fungal meningitis. So this is all about the dose available in the oral dose, but it is very rarely used. If it is used, it is given in the 50 to 100 mg. Also, there are topical preparation available, which are used for topical preparation for the vaginitis. It is available in tubes.
And for that, it is also available in the ear drops for the automycosis ear infections, fungizone otic 3% ear drops. For the intravenous preparation, we have the fungizone intravenous under the brand name Mycol 50 mg vial. We have, okay, 50 mg vial. In that we have the dry powder of the Amphotericin B, which is made with a sodium deoxycholate. It is a conventional preparation. How it is prepared: dry powder is mixed with 10 ml of water, diluted with 500 ml glucose solution, not with the normal saline. Makes the suspension course. Initially, before starting, we should test the patient with the hypersensitivity, and 1 mg is given. We have to wait till 10 minutes. If there are no serious infection, we can infuse it at the dose of 0.3 mg per kg. If it is well tolerated, slowly we have to increase the dose to 0.7 mg per kg, depending upon the tolerance. Okay, and then in the intrathecal injection, 0.5 mg twice weekly, it has been given for fungal meningitis. That's it about the dose of the amphotericin B. Hope this video has been helpful to you. If you have liked our video and our efforts, don't forget to subscribe, like, and share. Thank you.